As long as we maintain a for-profit system in our healthcare, we're not going to see a change. We can put all the band-aids you want on regulating drugs, streamlining administration. It won't matter, because at the end of the day, any changes will be clawed back by the system that allows big corporations to then buy out the next politician and just start this process all over again. We just have a vicious cycle until we get rid of the for-profit system in our healthcare. In this section, it's just policies to tackle these 4 areas to control costs. So the first of these is the push for regulating drug prices. So, quote, "The fundamental missing ingredient is political will. However, there will be no political will without increasing public pressure. These differences in healthcare costs should fuel more public pressure." So politicians won't do anything because they are lobbied and bought by the same corporations that we want them to regulate. Big corporations like United Healthcare, Pfizer, Mayo. Like, I think there was a case where, let me look it up, hold on. The Mayo Clinic has been exempt from multiple bills in Minnesota, including a nurse staffing bill and a tax exemption lawsuit. The details of the nurse staffing bill: in May 2023, the Mayo Clinic reached an agreement with state leaders to exempt all of its Minnesota facilities from keeping nurses at the Bedside Act. The bill would have required hospitals to form staffing committees with equal representation from direct care workers and hospital leaders. The Mayo Clinic threatened to move billions of dollars in investments out of state if the bill passed. So they'll threaten these politicians. They'll throw their money around the same way that companies will have essentially like an auction with certain states as to like where they're putting their headquarters. I remember like the second Amazon headquarters a while back, they were talking about which state can give them the best tax exemptions. Who will bend the knee most for these corporations? They will use every single loophole possible to avoid having to pay their fair share of taxes. So I opened up Open Secrets to further prove my point as to how much these corporations lobby politicians in order to keep them in their pockets. So top contributors of 2023 to 2024 under pharmaceuticals, we have Abbott Laboratories, $5,141,926. So Democrats, $594,866. To Republicans, $526,773. To liberal groups, $5,280. To conservative groups, $4,100,000. And to nonpartisan groups, $225. Roche Holdings, $1,377,475. $1,012,779 went to Democrats, and $337,066 went to Republicans. Again, it's not just Republicans, it's not just Democrats. They both get lobbied by the pharmaceutical industry in order to keep prices high. That's why we don't have any politicians putting out any bills to regulate them. If they do put them out, everybody rejects them. The pharmaceutical industry pays their politicians well to keep them in check, to make sure that they control the prices. And if anybody was wondering, for this past election, Kamala Harris received $9,033,801 from the pharmaceutical industry, while Donald Trump received $1,241,336. Y'all get the point. The politicians are bought. All of our politicians are bought. And it's not just healthcare, it's every single industry. The second set of policies I had a bit of an issue trying to figure out. 2 combined solutions can address the handful of high volume, high margin procedures and imaging. Many of these procedures are preferred sensitive. I had to look this up. Preference sensitive care. It's a type of medical care where the patient's values and preferences are more important than clinical evidence in determining the best treatment. This is because there isn't a clear support for one treatment option in the clinical evidence. Patient preference can include how they want to communicate with their healthcare provider, how much information they want about their illness, whether they want to be involved in decision making, their views on end-of-life care, their choice of medication or psychotherapy, whether they want to stay in hospital or go home, their preference for a provider's experience level or gender. Patient value and preference can vary based on the patient's culture, religious, and personal background. Back to the paper. Governmental and commercial payers should insist that all surgeons and proceduralists prove that patients have engaged in shared decision-making using decision aids with objective performance data as a requirement for being paid for the procedure. So how I'm understanding this is, I guess there's no law saying that they have to disclose whether or not they actually did speak to their patients and give them the options, fill them in on data regarding these procedures that they're about to undergo, what the recovery is going to be like. They're supposed to, but there's no way of, I guess at the moment, no way of proving it. This suggested policy is saying that it should be a proven thing that the patient was in communication throughout the process of their surgery, choosing what surgery to have. Here, simultaneously, payers should phase in reference pricing for all these procedures. Reference pricing, I had to look that up, is a strategy that uses a standard price to help consumers compare prices and make decisions. Purpose in healthcare, reference pricing helps consumers find the best price for a procedure, drug, or service. It can also encourage providers to compete on price and quality. And so, the final price should be at least 25% lower than the current average commercial prices and modified based on objective quality metrics, such as the rate of surgical site infections or other complications. For instance, the comparative data suggests that prices for both CAT scans and MRI scans, as well as cesarean deliveries, C-sections, could be reduced by 33% if reference prices were implemented. Reducing average CAT and MRI scan prices by 33% could reduce overall healthcare costs by an estimated $118 per capita. The administration of healthcare in the U.S., the suggestion is to streamline it, make the systems that we utilize more efficient, which will, quote, this will require moving towards a more automated process based on electronic health record data. For instance, procedure times are recorded and these electronic data could be used to determine time and thus payment without the need for scores of billing clerks. I think we can take it even a step further because as somebody who works in healthcare, there's a lot of BS because of things like insurance. If your blood work ends up in the wrong place because a nurse accidentally put it in the wrong box, got picked up by the wrong courier, it'll end up in a place where it's not supposed to go, and now the folks that have it just run it, and then you'll be charged for something you shouldn't be charged for because the location is out of network, right? These corporations have their own systems, their own test codes, their own software. So if blood work ends up at the wrong place, it takes time to code all of the tests, to find the account number, and it's a process. Where I was working at one point, we used to have buckets of hundreds of blood work waiting to be coded because it didn't come with the correct test code, because it came with a different form that wasn't meant for the place that I was working at. The average processor didn't know what the difference was between the complete metabolic panel, a basic metabolic panel, urinalysis. There were multiple forms of every one of these tests, right? You look in the catalog and it's confusing. A lot of folks come into this new to the field. There's a high turnover rate, so we're always training people. It wastes a lot of time. It wastes a lot of time, wastes a lot of resources. If the government took the entire healthcare industry and standardized it, so there's no more this system, this test code, that test code, right? Everybody used the same standard. It wouldn't matter where your blood work went. If there was no insurance, it wouldn't matter what doctor you go to. You could go wherever you want. You can get your blood work done wherever you want, and we wouldn't be wasting so much time on administrative costs, on all the BS. All of these are just band-aids to the core issue here, which is the for-profit system. Get rid of all these companies and have it be a government-run healthcare system. Get rid of the whole entire for-profit system out of our healthcare and focus it instead on health metrics. Have that be the drive. It gets rid of the incentive for the healthcare industry to lobby our politicians so they can get away with saving money, because that's their number one goal, is revenue. It's not health, it's revenue. And that has to change completely in order for us to see a change in the States, because we can regulate it as much as we want, but as long as the system is intact, we'll get to this point again. Having healthier people means less time away from work because you're sick, or having surgery because you waited too long because you didn't want to go for the preventative care because it's expensive, and so you held out, and now boom, you're sick, you have to lose a leg or two, right?